On. I can see Fidelia, Nelson, Ola. How are you all doing today? So we'll have an amazing time. Somebody asked how long is this likely going to take? So we'll have a session for about an hour, 30 minutes, which would also include question and answers. All right. And the reason why we are here today is simply because we want to talk about the opportunities within the health tech ecosystem. So for those of you that are nurses, you are in healthcare, you studied a master's in public health, or as the case might be, this is the best place you want to be. If you know somebody else that should be here today, get them right on this call. Copy the link to the meeting, send it to them, and let's get them on board. Okay? Get right into it. We're going to have an engaging session as much as possible. So I'd ask questions from time to time. And for us to have an amazing session, I want us to keep it engaged. Okay? Engaging. Ask questions. We'll have a Q&A at the end of the session. Don't miss that. Make a note of all the questions you have. Take away all distractions from you right now. And before we wrap up today, we'll have an amazing Q&A. So what are the opportunities, the career opportunities in health tech in 2026? How can you easily land a job? Okay. Now, one of the major reasons why we are here today, because we need to know why we are here in order to get to where we need to get to. All right. We have different categories of people in today's session. We have some career switchers. Most of you are career switchers moving from healthcare into tech. The broad category of people want to move into the tech ecosystem and you're coming from healthcare. We have another group of people. You are burnt out. You are physically strained. You are tired of bedside care. You are exhausted. You want to transition into the tech ecosystem, but you don't know where to start. There are so many people like this. The question is, what would happen to my past experience? Has anybody done it before? Can I do the same? What does it entail? And what does it take for me to take my nursing background and transition into health tech? And of course, some of you are nurses, you're a nurse, you're a healthcare assistant, you're a care worker, a support worker, a medical doctor, a physician, a nurse practitioner, and you want to transition, but you are scared of starting over. Do I have to start from ground zero? What exactly do I need to do? And then we have a group of people. You have the domain knowledge because you've worked in healthcare. I saw somebody in the chat who said, I am a nurse and time is very valuable to me. So you have the domain knowledge. You've been in healthcare. For some of you, you've done a master's. You've moved from your country. You've moved to the UK. You've moved to Canada. You've done some degree, master's in healthcare, but you don't know how to use it to your advantage. You are scared of what to do. And I want to let you know that fear, usually, when you are scared, is a perceived lack of options. A perceived lack of options. You think there are no options, but what I'm here to do today is to show you that you have options and how do you take advantage of that. So the first thing I'll be showing you is how to convert your healthcare experience into a job in tech within the space of 6 months. The skills you need to learn, how to gain the work experience, and so on. And I would also show you how to learn the skills to land a job in health tech. Okay, a lot of people go about this the wrong way. I made mistakes myself when I was trying to transition, but all those mistakes, you don't have to make the same mistake. So I'll show you the skills you need to learn, but more importantly, how do you learn those skills? And of course, we'll talk about how to gain the experience to show employers that you're the best candidate for that job. So you've always been a nurse, you've always been a care worker, a support worker. How do you show a potential employer that you have the skills as a healthcare data analyst, as a healthcare informatics analyst, as a pathology data analyst, and so on and so forth? How do you show them that you have that experience and that's the value you bring to the table? And finally, how do you start to land jobs? Where do you apply to jobs? How do you apply to jobs? No matter where you are, we'll look at some job boards, and eventually by the end of today's session, would have answered all these 4 questions. Okay, now who are we? For those of you joining us for the first time, we are Tenalytics, and Tenalytics is a leading educational technology company focused on helping people transition and land high-paying job within the tech ecosystem. Over the last 5 years, we've helped over 3,400 people across multiple roles transition into career paths like the healthcare data analyst, the healthcare informatics specialist, the healthcare data and reporting analyst across the US, the UK, Canada, across Africa, Europe, and so on and so forth. And in other areas, including data engineering, HR analytics, cybersecurity, project management, and so on. And for me, I'll be leading the session today. My name is Adaiza Suleiman. I'm a technology expert with over a decade experience cutting across data analytics and management consulting. I'm the founder of Tenalytics and the co-founder of Amdari. And using these two platforms, we've been able to help over 3,400 people with no prior tech background to transition into the tech ecosystem and land their very first jobs. Just like so many of you, my first degree had nothing to do with computer science or had nothing to do with technology. My first degree was in industrial chemistry. And I'm sure so many of you can relate to this. I studied industrial chemistry. I got out of the university. My very first job was as a management consultant. But then I also transitioned, just like so many of you will be doing today. I made a lot of mistakes and I realized that transitioning doesn't have to be that difficult. The reason why it was so difficult for me was because I had no guidance. I had no mentors. I had no idea what to learn first and what to learn last. So it took me time. But using Tenalytics and Amdari, we've been able to streamline that process. And I'll be sharing with you how over 3,400 people, just like you, starting from ground zero, were able to transition and land their first jobs. I'm currently a data analytics and data engineering contractor in Canada. I've lived and I've worked in the UK as a data science consultant. I worked remotely back when I was in Nigeria for companies in the US as a Power BI developer, as a data science consultant. I've worked with one of the largest privately owned energy conglomerates in sub-Saharan Africa as a data analyst, as a management information systems analyst. And I've worked with FITC, owned by the Bankers Committee and the Central Bank of Nigeria, as a data analytics consultant. My experience spans across multiple sectors, from energy to financial services, automobile, and so on and so forth. So I'll be sharing some experience with you today as we move on. Okay. Now, for anybody who wants to transition, and this is me showing you the roadmap you need to follow, the strategy you need to take in order to get to where you are currently as a nurse, physician, nurse practitioner, wherever you are today. How do you move from there and transition into health tech? The first thing you have to do, number one, is you get into a high demand career path in healthcare. Okay, you must find yourself in one of the high demand career paths in healthcare. So which means you already have the domain knowledge, but you need to you want to move into health tech. Which career path should you start looking at in health tech? Because if I find myself in a high demand role, what this simply means is I am making my job 10 times easier because employers would be actively searching for me. So you must get into a high demand career path. And there are so many high demand career paths within the healthcare space when you want to land a job in tech within healthcare. And I'll list a couple of them for you. The healthcare business analyst, super high demand. Healthcare informatics specialist, the healthcare data and reporting analyst. One of our alumni landed a job in the US, in Arizona, as a healthcare data and reporting analyst. The medical data analyst, the healthcare data analyst, the clinical data analyst, pathology data analyst. One of our participants also landed a job as a pathology data analyst with the NHS in the UK. Clinical decision support analyst, medical imaging analyst, healthcare AI engineer. Now, when you look at all these roles, one thing is common among all the roles I've shared with you today, and that is what? Data. So you'd see data featuring in so many of the roles. Okay, data featuring in so many roles. And the reason why that is simply because as a health tech professional, your focus would be helping that hospital, helping that medical institution, helping that medical insurance company make better decisions, take data-driven decisions by analyzing medical records, healthcare data, and so on and so forth. So number one is get into a high demand tech role in healthcare. And these are 10 of some of the most high in demand career path you want to look into. So I did a search last week, okay? And we'll be looking at some of these platforms. If you're in the UK, for example, looking at the NHS, over 3,080 jobs are currently available for roles within health tech with the NHS in the UK. You have roles like the pharmacy clinical informatics and data analyst. Very interesting job titles. Job titles that you never really understood. You never really knew that you could transition into those areas. Pharmacy clinical informatics and data analyst. And the salaries are also phenomenal. 56 to 63,000 pounds per annum. You have the medical device analyst. And if you go into the US, you go into Canada, you see roles like the healthcare data analyst. They require just 2 years experience for this entry-level role. It's an entry-level role, $105,000 per annum to $130,000 per annum. And searching for the healthcare data analyst role on this platform, over 4,500 roles are currently available in the US and Canada, where you can start applying to these jobs the moment you have the skills, you have the experience. And this is where we do our best job. Our best job is helping you learn these skills, number one, and showing you where to apply and how to apply. We're going to jump into some of these job boards as we move on today during our session. You have roles like the clinical analyst. Okay. And when you look at the job, the salary, the remuneration across board, you find out that in the UK, you have an average of 36,000 to 60,000 pounds per annum. In Canada, you have 66,000 to $106,000 on the average. Now, what this means is it doesn't mean that it is capped at 60,000 pounds. No. If you look at this role, for example, it's 63,000 pounds per annum. It could be higher, it could be lower, but this is the average per annum. You look at the US, $80,000 to $173,000 per annum. Now, like I mentioned earlier, fear is the perceived lack of options. So you have the healthcare knowledge. You've done a master's in public health. The question is, I'm tired of working in bedside care. I want to stay closer to my family. I don't want to sacrifice my family because I'm chasing a career. I want to transition. I think it's time for me to make that transition today. Are there options for me? Absolutely. Numerous options for you to take. And I'll be showing you how to get there and people that have already gotten there, like Sharon. Sharon was a healthcare assistant, like so many of you today, with the NHS in the UK. Sharon came to us in March last year, 2025. She joined one of our programs. We worked with Sharon. So the first thing she started with was to learn the skills. So we worked with Sharon. We helped her tailor her CV. She joined all our mentorship sessions. We guided her on the right path to take, how to apply to jobs, where to apply, how to build a portfolio. Sharon applied to numerous jobs, and eventually in May 2025, just about 3 months after she joined us, she landed a job as a business data analyst. And the role also came with sponsorship. You have someone like Pavel. Pavel was a teacher back in Cameroon, had no healthcare background, no healthcare knowledge. But today, Pavel is a healthcare data analyst in the US. How did he do it? Pavel came to us, completed his program in December 2024, joined our data analytics program in health tech. We tailored his CV to a healthcare data analyst role because Pavel could see that the opportunities within his city were in healthcare. He wanted to get a data analyst role within one of the healthcare institutions in Arizona. So he joined our program. We worked with him. We tailored his CV, learned all the skills, joined the mentorship sessions. We prepped him for multiple interviews. I worked personally with Pavel. I prepped him for his interviews and I helped him negotiate the salary when the offer came in. So he applied to multiple roles. And in March 2025, Pavel landed a job as a healthcare data analyst with the Arizona Community Physicians in Tucson, Arizona, in the US, less than 3 months after completing his program. You have somebody like Ikmat. Ikmat was a stay-at-home mom for over 4 years. She had a baby, wanted to take care of her baby. She was at home for a while, but she wanted to get back into the job market. Okay. Now, Ikmat moved to the UK for her master's in public health, but very quickly she realized that what she was learning in her master's in public health was totally different from the job requirements she saw whenever she checked for jobs available within the healthcare space. She realized that they were asking for things around Excel. They were asking for SQL and so on and so forth. She had no idea. She wasn't learning that in her master's. So what did she do? She joined our program because she wanted not just the job, she also wanted to get sponsorship. So she joined us. She joined a session like this, just like you've joined, and she knew exactly what she wanted. So she joined our program. We worked with her, prepped her for multiple interviews, and eventually she didn't just land a job in healthcare, she landed the job with sponsorship, full visa sponsorship in January 2024. And her role was as an information analyst with the NHS in the UK. Okay, so something I want you to see, and I'm going to show you that very quickly, is all the people I've shown you so far were very deliberate in the strategy that got them there. Okay, so I'm going to show you their profile. I want you to see something very quickly, and then we'll come back to continue our session. So for someone like Ikmat, for example, let's go to Ikmat's profile very quickly. What did she do right? So this is Ikmat right here. One of the first things you'd see is you both worked at Tenalytics. And if you scroll all the way down to Ikmat's profile, you'd see that just before she landed the job as an information analyst with the NHS, she had the data analyst role with Tenalytics. Very important. And this is positioning yourself for the opportunities, positioning yourself so employers, potential employers see you as the right person for that job. They see that you're currently on the roll and you can do this job for them. The interesting part about Ikmat's story is that at that time, the NHS wanted Ikmat to come in with only Excel and SQL. So that was the two major technologies in the job requirements at that time. Now, Ikmat joining us had learned Excel, she had learned SQL, and she had also added Power BI. Okay, so she told them during the interview that, of course, she's absolutely good with the use of Excel, with the use of SQL, but should be introducing Power BI to their reporting. I'll help you transition all your SQL, all your Excel dashboards into Power BI. And they were super impressed and they went for Ikmat. Ikmat had not completed the program before she landed this job. And just like Pavel, the other gentleman as well, who landed a job as a healthcare data analyst with the Arizona Community Physicians in the US. Again, this is Pavel. You both worked at Tenalytics. And if you scroll all the way down to his profile, you'd see data analyst with the Arizona Community Physicians, healthcare data and reporting analyst. Prior to that, what did he do? Data analyst with Tenalytics. Now, I'll explain why this positioning is very important when it comes to showcasing to the employer that you're the best candidate for the job. And one of the questions we always get is, oh, I'm currently on a health and care visa. I have restrictions for the type of things I can do outside healthcare. We show you exactly how to position yourself. So every employer sees you with your healthcare background and also the data analytics skills that you've combined to healthcare. And that positions you for roles like the healthcare data analyst, healthcare data reporting analyst, the information analyst, just like ICMAT, and so many other interesting roles within the health tech space. You have Evelyn. Evelyn was a nurse with over 15 years experience, and Evelyn transitioned into tech. Over 15 years experience in nursing. So what I've done is all the links to listen to these amazing professionals, and I'm going to play some of the videos for us before we wrap up today. So you get to listen to somebody like ICMAT. You get to listen to somebody like Dr. Arome, who was a medical doctor with over a decade experience, transitioned into tech. You have someone like Toyin. I'm going to play Toyin's video for you as well. You listen to Toyin. Toyin was a pharmacist back in Nigeria. She moved to the UK. Today, Toyin is a pharmacy data analyst. After working with Toyin, helping her learn the skills, gaining the experience, and so on and so forth. So number one is you must position yourself in a high demand career path. So you make the job search 10 times easier because employers are actually looking for you. So you can apply to those roles. You get the interviews. We work with you, prepare you for those interviews, and you land the job. That's the most important thing you want to do. Now, strategy number two is learning the skills required to land a job as a healthcare data analyst, landing a job in health tech, and how do you learn the right way? So I've seen a lot of people learning on YouTube. You became a nurse. You didn't become a nurse by watching videos on YouTube. You didn't become a physician by watching videos on Udemy. You didn't become a care worker by watching videos on YouTube and so on and so forth. So a lot of people make that mistake. And I see them I made the mistake myself. I had 1,001 courses on Udemy. I never completed. So what is the best way to learn the skills? What skills do you need to learn? And what's the best way to learn the skills? Okay. But before we jump into that, I want us to do a very quick exercise together. Okay. So we're going to keep it interactive. For those of you who want the recording at the end of the session, you want to have access to play all the videos, to listen to the amazing professionals that I've shown you that have transitioned from healthcare into health tech. For some of them, they had no experience in healthcare, but they also landed jobs in health tech, like Pavel, who was a teacher, but today he's a healthcare data and reporting analyst. All right. So fill the attendance form so you don't miss out on all the materials I'll be sharing with you today. My colleagues would share the attendance in the chat. So go to the chat, click on that, fill the attendance, and you have access to all the materials by the end of today's session. Before we dive into the skills you need to learn and how to learn the skills, we need to answer this question. What does a healthcare data analyst do? This is a question so many people ask. You have no idea. Today I'm a nurse or I'm a care worker, but when I get a job in health tech as a healthcare data analyst, as a clinical data analyst, what exactly would I be doing? Okay, so I'm going to walk you through that very quickly and would use this simple case study. The case study is on a mid-sized hospital currently facing ICU congestion, bed shortages, and rising inpatient costs. So they have congestion in the ICU. They have bed shortages. The inpatient costs are through the roof, rising day by day. So to improve the bed utilization, improving the patient flow and cost efficiency, and the quality of care to the patients, the hospital leadership wants to know how the length of stay varies by the medical condition, vary by the department, and the bed type. So the hospital leadership wants to know, how does the length of stay by medical condition? Does somebody who have a headache and somebody who has cancer, who stays longer? How does the length of stay affect, you know, how does the condition affect the length of stay? How does the department, the orthopedic department, neurology department, how does that department, oncology department, how does it affect the length of stay? And for the bed type as well, the private bed type, the general bed, and so on, how does this affect the length of stay of patients within the hospital? Okay, so we want to answer three critical questions. The first one is, which medical condition has the longest length of stay? Which department has the longest length of stay? Number two. And number three, what type of bed have the longest length of stay? These are the three questions we want to answer. And I want us to do it together. All right. Now, here is the data set that would help us answer these questions. Let's start with question number one. Which medical condition has the longest length of stay? So here you have the medical conditions. Okay. And then you have the length of stay right here. So I want you to look at the data and tell me, just type into the chart, which medical condition has the longest length of stay? Okay, just type into the chart. Harika says cancer. Let's get more feedback. Hafiza says heart disease, stroke. Diana says stroke. Josephine says heart attack. Okay, stroke, heart attack, and so many, cardiology, cancer. We have different answers, okay? But let's keep it coming. I want us to keep it interactive. Arthritis, heart disease, interesting. Severe trauma, mental illness. Olalekan says respiratory, okay? Josephine says severe trauma. Interesting. So it seems like everybody has an opinion on what medical condition has the longest length of stay. But that's question number one. Let's move to the next question. All right. Everybody has different answers, which is okay. Question number two, which department has the longest length of stay? So here you have the departments. Okay. And here you have the length of stay. So tell me, which department has the longest length of stay? Just type into the chart. Okay, cardiology, neurology, oncology, orthopedics, cardiology. Kafayat says oncology. Damilola says cardiology. Oluwafumilayo says neurology. Sarah says respiratory. Morayo says oncology. Ali says cardiology. Interesting. Yusuf says emergency. So we all have different answers. At least I've gotten like 5 different answers so far. Okay, now let's go to the last question for the day for this exercise. What type of beds have the longest length of stay? What type of beds? So here you have the hospital bed type and you have the length of stay. So what type of beds? Just type into the chart. What type of beds have the longest length of stay? ICU beds, private. I can see ICU private, semi-private, private general ward, ICU, semi-private. So we have different answers again. Okay. Now, this is the confusion that always comes when organizations like this hospital has no healthcare data analyst. So what does a healthcare data analyst do? They come into this hospital, they take the data that we've been giving our opinions on the longest length of stay for the medical condition, the department, and the bed type. If we took all the answers we've gotten so far and take it to the senior management or the management of the hospital, they can't make any decision because Kafayat is saying one thing, Damilola is saying another thing, Josephine is saying something else, and we all have it muddled up. So what the data analysts would do, the healthcare data analysts, the medical data analysts would take this data, use tools like Excel, Power BI, SQL, analyze the data, and generate a report that looks like this. So I'm going to ask the same questions again, and you'd see the importance of the healthcare data analyst. So let's start with question number 1 again. Which medical condition has the longest length of stay? So this is the chart that shows you the medical condition with the longest length of stay. So just type into the chart. Okay, tumor. Damilola says tumor. Josephine says tumor. Tejiri, Alice, Olayinka says tumor. Kafayat says tumor. Victoria says tumor. Ote says tumor. Anthony says tumor. Absolutely fantastic. You see the difference. Initially, it was like we all had our opinion, but now we can clearly see what that data actually says because it has been analyzed. The insight has been extracted. We can see clearly the medical condition with the longest length of stay. Now, question number 2, which department has the longest length of stay? And that's the chart right there that shows you which department has the longest length of stay. Just type into the chart. Oncology, Olayinka says oncology. Brilliant. Josephine, oncology. Juliet says oncology. Vincent, Adebayo. Everybody's on the same page now. Oncology has the longest length of stay. The final question, what bed type or what type of bed have the longest length of stay? That's chart number 3 right here. So type into the chart again one more time. Private room. Everybody says private room now. Initially, we had some people saying the semi-private room. We had some people saying ICU and so on and so forth. This is the job of the healthcare data analyst, the medical data analyst. What do? They take the healthcare data, the healthcare records, and they help analyze the data to make it easy for anybody who wants to make a decision from that data set. So they go to the medical information system, they go to the EMR, they extract these data sets, they analyze the data and present reports like this. So they take the messy data that gave us confusion, where everybody had different things they were saying, and they translate that data into dashboards that make it easy for anybody to understand. So the healthcare data analyst is a professional who helps to analyze healthcare, clinical data, medical records to support better medical decisions, to reduce costs, improve operational efficiency, and patient outcomes in medical institution. So if the hospital management sees this dashboard, they can tell clearly that tumor has the longest length of stay. Now, what do we need to do to reduce the length of stay? Are we using the right type of medication? Are we using the right processes and so on and so forth? The right questions can be asked, the right decisions can be taken because we're no longer looking at the messy data. We now have the dashboards and the reports. And this is just putting it simply. Your role would expand far beyond this, but this is what your role typically would involve. And as a healthcare data analyst, you work in hospitals, healthcare systems, government health agencies, healthcare insurance companies, NGOs, pharmaceutical companies, health tech organizations as well. But the mistakes a lot of people make, and before I move on from here, let me ask this question. Do you now have some understanding of what the healthcare data analyst in any organization would do today? Do you understand? Just type in a yes. Yes, if you understand. Fantastic. Okay, so they take data, analyze the data, the medical data, healthcare data, medical records, and so on and so forth. And they use that to generate dashboards and reports to help the management, the organization, take better decisions. They help to reduce costs. Because if everybody stays in the private room, how do we optimize that? Okay, what do we need to do? The right questions can be asked and we know the right decisions to take. But the mistakes a lot of people make is they learn by watching videos only. I mentioned that earlier, watching YouTube. I did that myself and it was always frustrating. So I watch a video, I have questions and I have nobody to ask questions. And I'm stuck on a problem for 2 weeks because there is nobody to guide me and say, this is what you need to do and, and to solve this particular issue. No real project, So you are learning by watching videos. You are not learning by doing the work. This makes it very difficult to know how to do the job on day one. When somebody like Pavel, who was a teacher, got a job as a healthcare data and reporting analyst, he didn't get there because he watched videos on YouTube. He got there because before he got that job, he had worked as a healthcare data and reporting analyst. He did work with us by taking real projects, real life projects from organizations, worked on the healthcare data, understood the type of metrics, the type of questions to ask, and that gave him the knowledge. When he went into the room, he knew exactly what to say. He knew the right terms, the terminologies to use, and eventually he landed that job. One other mistake people make is you don't have experience in health tech. Employers don't hire you today for what you tell them you can do. They hire you for what you have done. What you have done. What have you done before? Okay, you used to be a nurse. Now you want to become a clinical data analyst. What have you done as a clinical data analyst? What work have you done as a clinical data analyst? If you can't speak from a point of knowledge, from a point of experience, you're going to fall flat when it comes to landing that job. Most people don't have this, and that's why they struggle to make the transition. And of course, finally, you use generic CVs, generic LinkedIn profiles. You leave your profile as a nurse, you leave your profile as a medical practitioner, as a physician, and you want to use that to get a job in tech. That's not going to happen. All right. So we show you how to tailor your CVs. We show you how to structure your LinkedIn profile in a way that it showcases to any potential employer that this is what you know how to do and how good you are. And if you have restrictions, like so many people have in the UK with the health and care visa, we show you how to structure that not as work experience, but as projects that you've completed, which is allowed, even if you have restrictions on your visa and so on and so forth. And these are the things we do very, very well. It helped Ikmat land a job. So many other people I'll be sharing with you as we move on. Okay. And if you don't have a mentor, you don't have somebody to guide you along the line. If you listen to Ikmat's story, she said it categorically that it was as if the person that prepared her for the interview saw into the future and was able to identify all the questions that were going to be asked. So she prepared for those questions. She went into the room with the NHS. We helped her prepare her statements, personal statements, and so on, her supporting statements. She went into that interview and she crushed it. She answered all the questions and even gave them more. You want Excel, you want SQL, I'm going to give you Power BI in addition. And Ikmat landed that job. That's the role of somebody who is a mentor, a professional preparing you for those interviews. Okay? So what are the key skills you need to have getting a job in health tech as a health tech professional, transitioning from healthcare into the tech ecosystem? Number one is the domain knowledge in healthcare. Okay, this is where you understand the workings of the healthcare ecosystem wherever you are. You are in the UK, you know what the GDPR is all about when it comes to patient data. You are in the US, you know what HIPAA is all about. You are in Canada, you know what FIPA is all about, and so on and so forth. Okay, now understanding the domain knowledge, getting into that sector, you need to add something. And for those of you who are nurses, medical doctors, care workers, support workers, you already have that knowledge. You know the inner workings of the healthcare ecosystem. So you have diamonds in your hands, but you don't know because you already have the knowledge. All you need to do is to add data analytics skills. And for those who don't have the knowledge, maybe you're not in healthcare currently, you're not a nurse, but you want to land a job in healthcare because the NHS in the UK, for example, is the largest recruiter in the UK, the largest recruiter of talent in the UK. So you know the opportunities within that space. In the US, the healthcare sector hires some of the highest numbers of talent in the US, and same in Canada as well. So how do I tap into the opportunity from what we spoke about in number one, getting into a high demand career path? So you learn the domain knowledge. These are the things you learn when you work on the project during your program. And of course, you combine that with data analytics skills. And the data analytics skills you need to learn: problem solving, Microsoft Excel. So before you jump into the use of tools and technologies, you must know how to solve problems. You must know how to identify problems, break problems into multiple parts using techniques like the McKinsey-Mason model. You know how to use the 5 whys to get to the root cause of a problem. You need to know if you even have the data to answer that question for that hospital. If you don't have the data, how do you get the data to answer the question? So these are the things you would learn. What do you prioritize? The prioritization matrix, using those tools to answer and solve problems. That's where you start from before you move into the technologies like Microsoft Excel, SQL. Every medical institution would have data in a database, data in a data warehouse. And the reason is simple. That's because they have sensitive data. So not everybody would have access to the data. Now, as a healthcare data analyst, healthcare data reporting analyst, pathology data analyst, you'd have access to that database. But how do you get your data out of the database? That's where SQL becomes very important, structured query language. Then you learn Power BI. Okay, so you see the chart I shared with you earlier. This chart was built using Excel. Okay, so you build dashboards like this using Excel, using Power BI, and so on and so forth. Okay, so I built this in less than 15 minutes using Excel. So you'd learn how to do the same with Excel, with Power BI for your data visualization. You'd learn Tableau for your business intelligence, data visualization, and data storytelling. How do you tell a story from the data you've analyzed? How do you tell the story to the chief medical director who has no idea what Excel is or Power BI is? How do you tell them a story from the analysis you've carried out in a way that they can take a decision based on what you've told them from the data you've analyzed? You'd learn AI for health tech analytics using ChatGPT and Microsoft Fabric. And these are the tools and technologies that you need to learn to transition. And the beauty about this is you don't need to have any prior experience or prior knowledge in any of these tools or technologies to get started. So now that you know the tools and technologies to learn, the question is, what is the best way to learn? Is it by watching videos? Is it by reading books? What's the best way to learn? The best way to land a job in health tech is, number one, you learn in a project-based environment. And when you learn in a project-based environment, you are learning by doing the job. So you want to become a nurse. You don't become a nurse by watching videos. You become a nurse by doing the job of a nurse, working as a nurse, understanding what a nurse would do. And then you are able to transition into that role. We get projects from organizations like the NHS. We have over 100 plus alumni working with the NHS. Before they got in, the NHS would give you an assessment. They give you a data set. You analyze that data set. You make a presentation. So what we do is we take the data sets and we use them to generate case studies. So we get data from the NHS. We get data from medical institutions across the globe. These are the type of projects that you will work on. So you do the job of a clinical data analyst, a healthcare data and reporting analyst before you even get that job. That's the best way to learn. Learning by doing the job in a project-based environment. When you've done that, you move to the next step, which is showcase your work. People don't know you. Everybody knows you as a nurse. Everybody knows you as a care worker. Nobody knows how brilliant and fantastic you are in using Excel to build dashboards, using Power BI to analyze data, visualize data. You need to showcase your work. So when you've learned in a project-based environment, you've solved projects, you've completed projects, you put them in a portfolio. And that's how you showcase your work. People need to know how good you are. They need to know the quality of the problems that you solved. This is the best way to learn. Okay, so let's take Victoria as an example, and I will show you practically how this plays out, how you learn in a project-based environment, how you showcase that work in a portfolio to show everybody that you're the best candidate for that job. So let's assume Victoria wants to land a job with the NHS as a healthcare data analyst. What does she do? Victoria must learn She must learn working as a healthcare data analyst and have evidence for working as a healthcare data analyst. And how is Victoria going to do this? Very simple. I'm going to take you to Victoria's classroom. I'm going to take you to Victoria's portfolio. So you understand clearly how you learn in a project-based environment and how you showcase your work to potential employers. So if you want to land a job as a healthcare data analyst, you must learn by doing the job of a healthcare data analyst and have evidence for that. So let's go to Victoria's classroom very quickly. So Victoria joined a classroom, the health tech program she joined, and while she was learning Excel, Victoria didn't learn Excel by watching videos. She learned Excel by solving case studies for medical organizations, medical institutions. And one of them is St. Luke's Hospital. Okay. And this is a case study where you'd use Excel to solve a problem for this hospital. This hospital has problems. Okay, currently have problems across multiple areas. St. Luke's Hospital struggles with operational inefficiencies because they have unstructured data. So the hospital management lack visibility into patient trends, the performance of the hospital, emergency room efficiency, and so on and so forth. So what did Victoria do? Together with a professional, you'd solve this problem together. To solve the problem for the hospital, get their data into a central location, secured central location, and then you use that data to answer questions for the management of the hospital. And at the end of the day, you'd build a dashboard that looks like this using Microsoft's Excel. This is how you learn how to use Excel to solve real problems for a real medical organization. So this case study is a real organization. The difference is we've changed the data, we've changed the name of the hospital, so you cannot tie anything to anybody, to any hospital or to any individual for data privacy, but you get to work in this capacity. So I'll show you what the classroom looks like. Okay, so every single class is recorded. So if you miss this class, for example, you can always come back, listen to the recording, see what happened in class on that day. This is the same case study they're discussing in class with a professional who's going to work with you. All right. So you have the opportunity to ask questions. People asking questions, you can raise your hand and say, hey, I tried doing this on my Excel. It did not work exactly the way yours, played out. What exactly do I need to do? What am I doing wrong? How can I adjust? You have real-time feedback. When you are done with all of this, what do? You must showcase your work. So when you learn in a project-based environment, you solve these type of problems, you must have a portfolio. And I'll show you what a portfolio looks like. When Victoria completed this, she built a portfolio. Everybody built a portfolio. Victoria, Uchemadu, data analytics portfolio, and you'd see the project she has completed within the medical space. Deep Care Hospital, ER visit analysis. You can read about it, where she helped the emergency room reduce the patient wait time by 15% and increased the patient satisfaction by 20%. And how did she do this? You can click on the link and it takes you to exactly what Victoria has done. She built a dashboard using Power BI. Anybody can come in here. They can click on it. They can see what Victoria has done. They know how good Victoria is. And the beauty about this is the link to this portfolio would be on your CV and on your LinkedIn profile. So that potential employer can go to when they see your CV, it goes past the ATS and they're happy with you. They want to have a conversation. What happens? They want to see what you've done. So they go to your portfolio, they see the type of project you've completed. If they want somebody that knows how to use Tableau, they definitely would see Victoria as somebody that can use Tableau because she built this dashboard using Tableau. It is interactive. If I want to see data for only Q1 or Q2, I can deselect everything here, everything disappears. I can click on Q1 and the data reappears. I can see the number of ER patients, the average age. I can see the number of patients by race, by department, and so on and so forth. And this is what Victoria has built. So while she was learning in class, she was learning in a project-based environment, solving a problem for a hospital. When she completed that, what did she do? She built a portfolio, uploaded her project to the portfolio as evidence that she can do the job. The link would be on her CV, the link would be on her LinkedIn profile, and that's what you have to do. The best way to learn. Remember, you learn in a project-based environment and you must showcase your work. Okay, so we know what to do, number one, which is getting into a high demand career path, a career path employers are already recruiting for. And secondly, you must learn the skills the right way. So, what do I need to learn? And how do I learn those skills? When you've done that, you move to number three. Okay, and of course, you'd work on numerous projects. When you learn in a project-based environment, you help solve problems along operational efficiency, helping to improve the patient care, optimizing patient care for Deep Care Hospital. You have pharmaceutical projects where you help the pharmacy, with their data modeling. You help them transform their database into something that can be modeled and also give them the type of results that they want. You'd work on projects where you're forecasting emergency room within a different hospital. You are working and forecasting what the patient wait time would look like using tools like Tableau, Excel, and so on. By the time you are done, you'd have worked on over 10 projects that you add to your portfolio. When you compare yourself with 10 projects in your portfolio as evidence that you can do the job, and you are competing with somebody that has no portfolio, you can tell who would get that job. And these are some of the things that you need to do to position yourself to start landing the job. This is exactly what Ikmat did, exactly what Pavel did, exactly what Sharon did, and they were able to land jobs. Number three is to gain work experience. Employers don't care about what you tell them that you can do. You must show them that you have the experience. You must speak the language that they want to hear. Okay? You want to tell them about how you get data from the electronic healthcare records. You want to talk about the EMR, the electronic medical record, how you get data from there to analyze. You want to talk about the hospital information system. You want to talk about regulations within the healthcare space, like HIPAA, for those in the US, for example. For those in Canada, you have FIPA, which is the Personal Health Information Protection Act. HIPAA in the US is the Health Insurance Portability and Accountability Act. Okay. And for those in the UK, for example, you want to show them you understand the GDPR as it relates to data protection and regulation within the healthcare space. So you want to speak the language of your potential employer. You want to tell them the type of analysis you've carried out, because those are the questions they would ask you. Questions that are competency based, questions that aim to assess the experience that you have. So you want to tell them how you worked on metrics like the length of stay, the readmission rate, the mortality rate, the bed occupancy rate, cost per patient, the patient pull-through rate, and so on and so forth. Okay, so these are the things you want to prepare for. And the only way you can answer these questions is if you have done them before. Experience. You must have gained experience working in that capacity. And how you gain experience working as a healthcare data analyst, medical data analyst, healthcare reporting analyst. Number one is the projects. I've shown you the projects. You'd work on a minimum of 10 projects by the time you are done. Those projects gives you the understanding, the metrics on how to do the job. What any organization, any hospital, medical institution would want to analyze, and how to answer competency-based questions when you get into the interviews. Okay? Employers want to see what you've already done. So before the interview even happens, employers want to know, recruiters want to know and understand how good you are. They want to see the value that you bring to the table. And that's why you must position yourself as the best candidate, the strongest candidate. So you must build experience through your what? Your projects, through project-based learning. And then you have 2 months internship with our sister company, Amdari. So when you learn with analytics, you learn all the skills, you work on your project and so on. You then move to Amdari for your internship. So Amdari operates out of London in the UK and also Alberta in Canada. So you can list these organizations as your work experience. You can list these organizations as where you volunteered. You can list these organizations as where you pass through a career acceleration program. For those of you who have visa issues and you might think of how to structure that, we work with you on how to best represent the experience you gain from us. And the beauty about having this experience is you can always come back to us for references. And I'll show you how that works. So you learn with analytics, you come to Amdari for your 2 months internship. This is how you gain work experience. Employers want to know that you have team working skills, interpersonal skills, communication skills. You can work well within a team. Because as a healthcare data analyst, you don't work in silos. You collaborate with other professionals within that organization to solve problems. So this is where you get to simulate that with Amdari. You work with other professionals as a healthcare data analyst. For those of you in health tech, you'd work with a cybersecurity professional. You'd work with a business analyst. You'd work with a project manager. And together you'd solve problems together. You'd solve problems as a unit because that's the real world of work. That's what you do in the real world. And when you do that, you must build a portfolio. Very important. Okay, so I showed you what a portfolio looks like already. You have an idea of what a portfolio looks like. So when you learn in a project-based environment, all the projects you've completed, you upload to your portfolio. That is evidence that you've done that job. Then you join Amdari for your work experience. You can list Amdari as where you've worked. You can get reference from Amdari. You can list analytics as where you've worked. And that's exactly what these amazing professionals did. This is Pavel. That's exactly what Pavel did. I showed you that earlier. You both worked at Analytics. And when he had his first interview with the Arizona community physicians, they were very impressed that he knew how to use Excel. He knew how to use Power BI. He knew how to use Tableau because they could see that he had worked as a data analyst with Tenalytics. I wrote and prepared Pavel's reference because the organization would always reach out to you. They want a reputable organization that can vouch for the skills that you have. Is Pavel who he says he is? What's the best way to manage Pavel? Was Pavel ever late? What's his punctuality like? And so on and so forth. What are his strengths and his weaknesses? He said he did this using SQL, using Tableau. Is this exactly what he did? You can answer those questions. And organizations will do that background check to ensure that they're hiring the right candidates. That's how you gain work experience. Project-based learning, upload all your projects to your portfolio, 2 months internship where you get to work on cross-functional projects. You get to work together as a team to solve a common problem, and everything gets added to your portfolio. If I click on one of these portfolios, and again, like I said, you'd have access to all of these. So make sure you fill the attendance form in the chat. That's the only way you get access to my slides, the recording, and all the other materials from today's session. So if I click on this, for example, it takes me to a different portfolio. This is Melody. Okay. And I can see the project Melody has completed. All right. And I can scroll all the way down and I'm going to see the project she completed in healthcare. Okay. This is Novamed Solutions. This is for a pharmaceutical company, just helping them distribute pharmaceutical distribution company. So you use Power BI to design a dashboard for Novamed, a pharmaceutical distributor, to uncover insights for them. All right. Riverside General Hospital data model. You use SQL to build a data model for this hospital. These are the type of projects you complete and you upload to your portfolio. All right. And of course, once you've done this, you move to strategy number 4, which I've talked about kind of, which is a reference. A lot of people make this mistake. They forget that to land a job, you actually need a reference. This is a reference just to help you simulate and understand what a typical reference would look like. This came from the NHS, the Southeast Hospital NHS Foundation Trust. Dear Deza Suleiman, that's me. Okay. We are currently recruiting these candidates for a pathology data analyst role. He has provided your details and given us the permission to approach you for a reference. Would be grateful if you could share your opinion. Let me have your opinion regarding his suitability for the post by completing the attached reference request form. No organization would hire you if there is nobody to vouch for you. So one of the things we do is to ensure that as you list Tenalytics or Amdari as part of your work experience, it also forms a pathway for referencing for you. All right. And for the NHS, all you need to do is either fill the form they've attached or you simply click on this link and fill the details right there. And this is the reference of an actual candidate who landed a job as a pathology data analyst. And the interesting part for this candidate was he didn't even have a healthcare background. His background was in operations management. And then all the things I've shown you how to do, the projects, joining Amdari to work on more projects in a cross-functional environment, doing his CV, joining the interview session, preparation sessions, and all of that. He was able to land a job as a pathology data analyst. So everything I've shared with you today, what you want to do in summary, number 1 is to learn. You learn the data analytics skills from problem solving to Excel to Power BI to SQL to Tableau, ChatGPT for health tech analytics, Microsoft Fabric, data storytelling, and so on. And then the healthcare domain knowledge. And you focus on that. You're not jumping from this to this and that tomorrow. You focus on this and you learn the skills. And how do you learn with us? You learn in a blended approach. You have your live classes and you also have your self-paced classes. And I'll show you what the self-paced classes look like. The self-paced class is where you log into the LMS at your own convenience, any day, anytime, and you have access to your materials. And your live class is every Saturday, 11 a.m. to 2 p.m. for those in the UK, Europe, similar time zones. 10 a.m. to 1 p.m. Mountain Time for those in Canada and in the US, North America. So it doesn't matter where you are, there's a class that fits your schedule. You join that class every Saturday, there's a professional walking you through the project you're going to complete. You solve the projects together, you upload those projects into your portfolio. You know how to do the job before you even get the job. That's how you learn. Every other day outside Saturday, on a Sunday, on a Monday, at your own convenience, any day, anytime, anywhere, you log into the LMS. This is what the LMS looks like. You log into the learning management system. Everybody would have access to this. And you'd see this says, welcome back Adeza. So if Olayinka has registered or Emmanuel has registered, it will be welcome back Olayinka, welcome back Emmanuel. You go to the program you've registered for, you click on that program, and it takes you to your class where you start to learn at your own convenience, any day, anytime, anywhere. And you have your live classes. Your live classes happens on Saturdays. Every class is recorded. So if you miss that live class, you always have a reference to come back to. You can come back to the recording, watch the recording, and you don't miss anything. That's how you learn, blended learning. Once you've done that, one of the most important things you also have to do, which we do for you, is packaging. Packaging is positioning you and presenting you as the best candidate for that job. You've had your experience in one specific sector. You've had experience as a nurse, as a care worker, as a support worker, as a nurse practitioner. Now you want to position yourself for a health tech role. What do you need to do? I've said it, I've said some of them already, which is you gain experience. We help you tailor your CV. So your very first CV, we help you tailor that CV to the industry standard with the right keywords. So when anybody sees your CV and when you submit that application, it goes past the ATS. They can then look at your profile, look at your portfolio, and they get impressed and invite you for an interview. So we don't just work on your CV for you. We show you how to tailor your CV to the job requirements. Okay. We help you with your LinkedIn profile as well. LinkedIn optimization, your portfolio. You've seen the portfolios that I showed you. Everybody gets to build a portfolio. You must have a portfolio. Your portfolio is evidence that you've done that job before and the quality of the work you've done. And you want to showcase that to the whole world that this is what you know how to do. Then you have your mentorship sessions, which is one of the best things you would want to join. We have mentorship sessions every Thursdays in the evening. So even if you miss that mentorship, so let's assume you miss a mentorship session on a Thursday, for example, Thursday in the evenings, okay? You're in the UK, it's around 10 p.m. UK time, 10 to 11. You have your mentorship sessions. For those in Canada, those in the US, it's always staggered. So this week you have your mentorship for the UK, US. The next week you have for the US, Canada. The following week, UK, Europe, Africa, similar time zones. And that's how we stagger the different mentorship sessions. So the last mentorship that happened, how to diagnose a company, okay, how to diagnose a company and win the interview. So here you had a professional come into this session to show you before you get into that interview, what steps do you take to understand the problems the organization currently have? How to learn to research and analyze the company effectively, understanding how to identify the company pain points, discover and align your skills with the company, what the company truly wants, and gain strategies to confidently stand out and win interviews. If you miss this session, you can always come back, watch the recording. You'd see exactly what happened.
Okay. Hi.
Okay. You have your facilitator, Lola Femi, who has experience across multiple sectors. She would help you understand exactly what to do before you get into an interview. These are the quality sessions you have for the mentorship. From applicants to assets, LinkedIn optimization, how to use the seats and star approach for interviews. All right. So you have all these amazing sessions which you join during the mentorship. And of course, when you've done all of that and you've started applying to jobs, you will get interviews. When you get interviews, what happens? We prep you for those interviews. And how do you get prepped for interviews? All you need to do is go to your learning management system, go to your dashboard, and right at the top right corner, you'd see where you have interview preparation. Just click on schedule mock interview session, fill all the details, enter the URL for the job, um, copy and paste the job description, upload the CV you've used to apply, and somebody would prepare you for the interview. So you have all the support that you need. You don't miss out on anything. When you have an interview, you don't need to speak to anyone. You don't need to send an email. Just come in here, click on schedule mock interview session, book your interview prep, and somebody would prepare you for that interview. So you get into the room, we would have seen what the job description looks like, and we know the questions you're going to get asked. For the different organizations, for the NHS, you want to land a job with the NHS, we know the type of questions they ask. We know the type of case studies they give to you. We prepare you ahead of it. So when you get into that room, you're answering all the questions, and that's how you land the job. And when you land the job, you need a reference. We write a reference for you. I showed you what that looks like. And when you get the job and you need support, we provide you with on-the-job support. So when you learn all the skills, you package by presenting and positioning yourself as the best candidate for the job. We show you how to apply, tailoring every application that you put out there, never reusing the same CV for two applications. You know the type of and the quality applications you need to make, the number of applications you need to make. We show you how to tap into the paid and the hidden job market. So what we do is to use platforms that a lot of people are not aware of. They are paid platforms. We pay to these platforms, we scrape jobs from these platforms, and we send them to you. Every Sundays, you have new jobs in your classroom. So if you go to your classroom under important materials, you'd see something called job offers. If you click on that sheet, it takes you to exclusive jobs that we have validated that these are the type of jobs you can get. And we get them from platforms that are not general to the public because they are paid platforms. So we pay, so you don't have to pay. So you have access to these jobs and you go ahead to apply, and we show you other platforms that you can go ahead and apply to jobs. There's so many of them. One of my favorites for those of you in the US, Canada, for example, is JobRite. Okay, jobrite.ai. If you go to jobrite.ai, for example, and we search for the health care data analyst role, okay, you have over 4,445 healthcare data analyst roles available. This was posted 6 hours ago. Less than 25 people have applied. You can go ahead and start applying to this job. So what we do is we help you get your CV to a 90% match before you put in that application. So when you put in the application, what happens? You get called for an interview. When you get called for an interview, what happens? We prep you for that interview. And just like all the amazing professionals, you also land the job. This was posted 1 hour ago. Healthcare data and operations analyst. This was posted yesterday. Senior healthcare data analyst, healthcare data analyst, lead data analyst, healthcare analytics, and so many amazing jobs. Clinical data analysts, healthcare services data analysts, and so on and so forth. If you're in the US, Canada, you want to land a job in healthcare, this is one of the best platforms for you to use. If you are in the UK, most of you know NHS Jobs. Um, NHS Jobs is a fantastic platform for you to use. We also use UK Visa Jobs, which is exclusive to visa sponsorship jobs. And that's a platform you have to pay for. So we pay for it. You log into the platform, we scrape the jobs, and we send them to you. So if I go to NHS Jobs, for example, and I simply just search for data analyst roles within the NHS in healthcare, you'd see numerous jobs. Today, about 3,086 jobs available. The data analyst plasma, vascular data analyst, clinical governance coordinator, data architect, and so on. So many amazing opportunities. Let's go to the next page and you see different data quality analyst, data and impact lead, and so on and so forth. Okay, so we show you where to apply, how to apply, and there's so many other platforms. The healthjobs.com, for example, if you search for the data analyst roles, you'd see roles within the space: senior clinical data modeler, information and performance analyst, senior data scientist, clinical coding business analyst, and so on and so forth. So one of the best things that we do is to show you where to apply and show you how to apply for the jobs that we know that you'll get if you put in your application. And once you've joined to learn, You learn the skills, you get the domain knowledge, you present and position yourself as the best candidate for the job, from your CV to your LinkedIn to your portfolio, gaining work experience, getting interview prep, having somebody to reference you when you get that job, on the job support. You package yourself and you know where to apply, you know how to apply, you know how to tailor your CV to jobs. That's where you land the job. So in terms of how you learn for 6 months with us at 10 Analytics, and then you have your 2 month internship with Amdari, our sister company, Amdari, where you get to work with other professionals to solve problems as a group. What we've seen happen typically is you don't need to wait 8 months to land a job. I'm going to play one of the videos. You listen to Ikmat, you listen to Tony. Tony landed a job in about 2 months after joining us. Ikmat landed a job about 3 months, 3 to 4 months after joining. And people ask the question, how is it possible? The program is for 8 months. How can I land a job in 3 to 4 months? It's very simple. For so many organizations, they have specific set of skills and tools they want you to have. Let's take, for example, the one just like Ikmat. Ikmat, the job required only Excel and SQL at the time she applied. And within the first 2 months, she had learned Excel and SQL with us. And during our mentorship, we push you to go ahead and apply. You have the skills required for this job, for example. Don't wait until you complete the program. Apply to that job. You've learned Excel, you've learned SQL, you've worked on projects. When you apply, because you've tailored your CV, because you know how to tailor your CV, we've worked on an industry standard CV for you. You get an interview. We prep you for that interview and you land the job. That's how you can get the job a lot earlier than the entire 8 months. So as you learn and add more skills to your toolkit, you have the opportunity to apply to more jobs within that space. Okay. So you learn for 6 months, 2 months internship. For those in the UK, 11 a.m. to 2 p.m. UK time on Saturdays, you have a live class where you work on projects together with a professional. For those in the US, Canada, 10 a.m. to 1 p.m. Mountain Time. So if you're in the UK and you're not available in the morning, for example, 11 a.m. to 2 p.m., you can join the class for US, Canada, and you join them 6 p.m. to 9 p.m. in the evening. So you have that flexibility of either joining in the morning or joining in the evening based on your preference. And of course, every other day you're on the LMS watching your videos, practicing, and you have the opportunity to ask questions whenever you have questions. So let's assume you are learning on a Wednesday or you're learning on a Tuesday and you have a question. What do you do? All you need to do is go to your classroom and you'd see something called book a drop-in session. So let's assume I'm learning on a Tuesday. I'm on my LMS learning and I have a question. I need somebody to sit down with me to explain. What do? I come in here, book a drop-in session, and I click on the link and I can book a session any day. Okay. The days available, for example, I have a day available on Monday, Thursday, and Friday. I can book a session, on Monday. I want somebody to sit down with me on Monday and explain this problem to me. I'm a bit confused. I don't know what to do. Show me how to solve this problem. And somebody will join you on that call, look at the problem you have, and help you address it. So you are never left alone. Okay. If I want to book in March, you have Mondays to Fridays. Mondays to Fridays are available for you to book. So you can book drop-in sessions any day of the week as long as you have availability for those days. So here, Tuesday and Wednesdays have been fully booked. So if you have a problem, you want to solve that problem, you want to book time on Monday, you want to book time on Thursday, you want to book time on Fridays. Okay. And if you want to book into the future, you can always book and somebody will join a session with you one-on-one to help you address that problem. And of course, you have your mentorship sessions every Thursdays, 10 p.m. UK time for those in the UK, and for those in the US, 8 p.m. Mountain time. So everybody is catered for. And the beauty about everything I've said so far is you have lifetime access to both the classroom and also the LMS, where you have your self-paced materials. You have lifetime access. So even after you've gotten a job and you want to go back to refer to what you've done before, you have the opportunity to do that. Okay, so this is the structure of how you learn with us at 10Analytics. That's exactly how Toyin, I've talked about Toyin. Toyin was a pharmacist in Nigeria. Today, Toyin is a pharmacy data analyst. She moved to the UK. Toyin joined our program, Data Analytics, because she wanted to transition into health tech. And guess what? She wanted sponsorship as well. And she was able to land a job, first of all, as a benefits analyst. And then she landed her second job as a pharmacy data analyst with the NHS in the UK. Okay. And this is what Toyin's profile looks like. I'm going to show you Toyin very quickly. So that's Toyin right there. Absolutely phenomenal professional pharmacy data analyst with the Royal Surrey NHS Foundation Trust. Before she got this job, she was a benefits analyst. So when she completed her program, she landed her very first job. We prepared her for her interview as a benefits analyst. Then in February last year, she moved from that role into a pharmacy data analyst, taking a pharmaceutical background as a pharmacist back in Nigeria, getting that job as a pharmacy data analyst. So I want you to listen to Toyin in 1 minute and hear what Toyin has to say. Okay. And then we'll also come back, listen to maybe one or two other professionals, and then we move into our Q&A. So let's listen to Toyin very quickly.
Hello, everyone. My name is Toyin.
Okay. So it's just for 1 minute. I'm just going to ensure that you can hear Toyin when she speaks. And then I'll come back, play another amazing professional, hear what they have to say about their transition story, and then I'll show you how do you start today. For those of you that are ready to get started, what does it take for you to start? How do you get a job like Toyin? How do you get a job like Ikmat? How do you get a job like Pavel and so many other professionals that have made the transition? I'll show you how to do that, and then we'll have our Q&A before we call it a day. So let's listen to Toyin very quickly.
Hello, everyone. My name is Toyin, and I recently got a job as a benefits analyst in the UK. I've come from a medical background as a pharmacist who is interested in, breaking into tech. My first encounter with analytics was on LinkedIn. I joined one of their masterclass, just one masterclass where Efemina spoke, and it just took that masterclass to convince me. I joined in August, and a month after, I got a job. To be honest with you, every information skill that I was able to apply to get that job, I owe it to 10Analytics. 10Analytics did a great job and is still doing a great job. They groom you and nurture you from the cradle till you become confident. So my advice for you, most importantly, is join. Be integrated into a platform that empowers you and allows you to easily get that first job.
So that's Toyin. Today, Toyin is a pharmacy data analyst doing amazingly well with the NHS as a professional who moved from a pharmacist to today working as a pharmacy data analyst in health tech. You have Gad. Gad was a mechanical engineer back in Nigeria. He moved to the UK for his master's. He joined our program. We helped him. He learned, we prepared him, positioned him for the jobs available as the best candidate for the job. We tailored his CV, joined all our mentorship sessions. He applied to jobs. And last year, January 2025, he landed a job also with the NHS, also on full visa sponsorship as a data warehouse and ETL developer. All right. You have Mawutin. Mawutin was an operations manager. He came to us, we worked with him, prepped him for his interviews, all the amazing stuff. Mawutin landed a job as a pathology data analyst. Okay, so you see that division of pathology, data analyst. The job title for Mawutin was a pathology data analyst. I wrote Mawutin's reference for him when he landed that job. You have Judith. Judith was a carer back in the UK. She wanted to leave the job as a care worker. She came to us. We worked with Judith. She learned the skills. We prepped her for our interviews. And Judith didn't just land a job. She landed a job from the UK 3 months after her program. She landed a job from the UK with a company in the US, working remotely with that company in the US. You have Evelyn, who was a nurse. Evelyn had 15 years experience in nursing. Evelyn transitioned to data engineering. You have Dr. Arome, over a decade experience as a medical doctor. Today, he's a data analyst. And I want us to listen to Dr. Arome and probably play one more video, and then we'll get into our Q&A. But let's hear from Dr. Arome, a medical doctor who was able to transition into data analytics. Okay, I'm going to look for that video. So just sit back. It's a 47-second video, but he gave you some very important, he's going to give you some very important gems on what he needed to do to help him transition.
Hello there, I'm a medical doctor, and I want to give thanks to the staff in Analytics for making me a data analyst today. They are such a great people. They have a well-grounded knowledge of tech. Currently, I could say I'm an expert. I know a lot about Excel. I have knowledge in Power BI and SQL. These were things I never knew anything about. I was a novice, but today I can beat my chest and confidently say I can do a lot with these tools, and it's going to help promote and upgrade my career and make me fit into this developing world of tech. Thank you very much, Analytics.
Hi everyone, my name is Evelyn.
Okay, so that's Evelyn who was about to speak. Evelyn she worked as a nurse for over 15 years. Today, Evelyn is a data engineer. So there's so many other professionals. You have Abigail, who was a care worker in Saskatchewan, Canada. Today, Abigail works with the government of Alberta as a supervisor, business services, and data analytics after joining one of our programs. You have Esther, who was a care worker. Today, Esther works with the UK Civil Service as a contract project officer, and so many other professionals. All right. So what does it take for you to start today? For those of you who want to start and transition into health tech, you have the experience, you have the knowledge in healthcare, you are a care worker, you are a support worker, you've seen other professionals in that same position. What do you do to transition? Get into a high demand career path, number one. Learn the right way, learning the skills by working in a project-based environment and showcasing your skills in a portfolio. Gaining work experience to showcase to employers they are the best candidate for the job. And how do you gain work experience? You must intern on that role. I want to get a job as a healthcare data analyst. You must intern. You must also work in a project-based environment and have a portfolio. So any potential employer that comes across your profile, they see that this is something you've done and it's not something you tell them that you can do. You've done that already. Number four, you must have a reputable organization that can vouch for you, write a reference for you that these are the things you can do and these are the things you've done, and they vouch for you to land that job. Okay, so for so many people, the most difficult decision for them is to take the first step. And the first step is taking action. I've listened to this so many times. Some of you joined last week. We had an amazing time. You've joined again this week, but you still haven't taken action. So the big question is take action. You can't stay where you are. If you want to make a change in 2026, you actually have to make a change. You can't listen to all these conversations and do nothing about it. Nothing will happen when you don't take any action. All right. So you can't listen to all of this. You still remain where you are. We come back here in October. We have a session like this in October 2026, and you are still in the same position. You have to make a change. Our next cohort starts on the 7th of March, 2026. And I have an amazing offer for everybody willing to start today. So if you are willing to start your transition journey today, I have an amazing offer for you. Okay, and I'm going to share that offer with you. Two amazing offers, actually. And I'll share the two offers with you, how to start, and also what additional benefits you stand to gain. All right, but I want us to listen to Ikmat, who was a stay-at-home mom, who currently works with the NHS today. The importance of Ikmat's story transcends what so many people feel is impossible. Okay, Ikmat was out of work for 4 years and she wanted to get back into the job market. She got into the university for her master's. She realized that what she was learning in the university was not enough to land a job. So what did she do? She decided to upskill. She took action. She joined the health tech program. She learned data analytics. In addition to her master's in public health, we prepped her for her interviews and she got 2 offers with sponsorship. And she took the one that gave her the opportunity to work remotely, to work from home, and goes to the office for some days during the week. And she had a hybrid work model. So let's listen to Ikmat very quickly, and then we'll come back and I'll show you the amazing offers I have for you.
Hi everyone, my name is Ikmat, and I was with the March cohort in Tenalytics, and joining Tenalytics has been the best decision so far. You know, for me, someone coming from a background of full housewife, because I had to stay back home to look after my child for 4 years, and then wanting to break into something new, wanting to go back into the workforce, you know, wanting to place myself in the society for better job opportunities. So it was a lot, and then I'm glad that Tenalytics came along, and then they presented me with so many opportunities right in front of me, better opportunities, and then I'm glad I took it. And then also the advice of do not sell yourself short, that Effie is always saying, it is very, very valid, because place yourself right, you know, don't sell yourself short. It's a very, very, very valid advice. You know, in Tenalytics, they will hold your hands like a child, you know, through the modules. You have the opportunity to go back and study. You have the opportunity to go back and practice. You have the opportunity to ask questions. You know, we have people you can always go back to, even outside of class hours. It's the most amazing experience so far, really. And then another thing is the interview prep, guys. That is another very important thing. I did my interview prep with Mr. Mohammed, and it is the best decision ever, because it was like he saw into the future. He knew what was going to be asked, and I'm glad that I wrote down all the things he mentioned. I went back to practice, and then when it was time for the interview, it was like everything he was mentioning, everything he mentioned, they kept on. And then when I was answering those questions, I was so confident, you know, because I already practiced. I did an Excel test, I did a maths test, and then they were really impressed. And another thing is, guys, it may not come as fast as you expect. Definitely you are going to get some no's, and then you may begin to think you're not good enough. You are good enough, yes. The no's will come, but always take it as a basis for learning and development, because after every interview where I got a no, I always make sure I get a personal feedback. So I work on those feedbacks for my next interviews, and yes, it worked. It really worked for me, because I got my first job 3 months into the program, my first job. But I couldn't take up the job because I was a student and I was only eligible to work 20 hours, so I couldn't take up the job. 3 months later, I got 2 jobs with full visa sponsorship. And guys, all the other no's before the 2 jobs prepared me for the yeses I got. So yes, the no's will come, but do not give up, because you always have Tenalytics to go back to. They are the best and the best thing that's ever happened to me. And then yes, and they are the most affordable. The most affordable one I've come across so far, and that's a very good advantage. So yes, Tenalytics for the win.
So that's Ikmat. a phenomenal professional. Ikmat currently works with the NHS. I think I showed Ikmat's profile earlier. I'm not sure if yes, I think I did. That's Ikmat right there. She says something very interesting. She says, I work in the healthcare space and I use data for good. That's what I do. I use data for good. And that's Ikmat. So what we do is we always bring people like Ikmat, we bring people like Ramat, Pavel, Toyin, we bring them back to help other professionals who are also looking to get into the NHS. So you have body mentors, mentors that are like you. They were like you a few months ago. Okay. But today they've been able to land amazing opportunities. All right. So that's Ikmat's story. Always very inspiring for anybody looking to get started. So the next cohort starts March 7th for those of you looking to start your journey transitioning into health tech. And my first offer that I have for you, the program itself is $1,250 for the full 8 months and everything that I've shared so far. The CV, the LinkedIn, the interview prep, the lifetime access to all the materials. So joining the health tech program is $1,250. But rather than paying that, we have an amazing 20% discount for you. You get to pay just $1,000. And in addition to the 20% discount, you can also make payments in multiple installments. Because one of the things we've seen that hold people back most of the time is financial constraints. So how do you get started even with the minimal amount of money for you to get your journey going? Okay, so you can pay up to 5 installments. The $1,000 discounts can be made in about 5 installments, and I'll show you how to go about that. All right, but the discount is not available for everyone because we also have a limited capacity that we can take at a given time. So we have the discount for the first 20 people that registers for the health tech program. So you have the opportunity to, first of all, take advantage of the 20% discount, and you also have more. All right. So for those that register before Monday, you register today, you register on Sunday, and you fall within the first 20 people to register, you also get the advantage of joining the founder circle. So the founder circle is where you get access to the founders of both Tenalytics and Amdari, and you have the opportunity to chart a roadmap before you start your journey on the 7th of March. So you know where you're starting, you know what you need to do at every given point in time. It's exclusive access. Not everybody has this access. So you have that, number one. So you join myself, you join the co-founder Ifemena, and together we show you exactly what you need to do from step by step. So when you start with the right mindset and you know what to do. The first 20 people get the advantage of this. You also have the opportunity to join the weekly mentorship from next week, Thursday. So you don't need to wait until you start on the 7th of March. You can have access to the mentorship, early access, right from next week, Thursday. You have the opportunity to join. So you learn from industry experts. You start to see what the interview simulations look like, and you get exclusive early access to the mentorship session as well. You also have access to an exclusive event we have coming up for those who are looking for alternative visa pathways, like the Global Talent Visa, for example. Okay, so we have a session on that. It's exclusive, not for the general public. You'd have the opportunity to join and to learn how to take advantage of opportunities within the global talent space where you can apply if you have experience or you have skills in arts and culture or you have skills in tech. How do you take advantage of that to get into the get the global talent endorsements, the technician endorsement, and of course, apply for the global talent visa. And one thing we also do is we provide you with a reference. For the global talent visa, you need 10 pieces of information, of evidence to get the visa, 10 pieces of evidence to get your endorsements before you get the visa. We write your reference for you. And finally, you also have lifetime career support. Okay. So you have lifetime interview prep, lifetime to references, and lifetime to mentorship. Okay, so you have this also available for the first 20 people that pay. This means getting to the front of the line. You skip to the front of the line and you have something I call front of the line advantage. So you join the founder circle, you have early access to the weekly mentorship, access to join our exclusive sessions on alternative visa pathways, and you also have the opportunity to have lifetime access to interview prep. So it doesn't matter, in 2030, you are moving to a new role and you need somebody to prep you for that interview. You can always come back to us. We prep you for that interview. You need a reference. We write a reference for you as well. And I'll show you people that have taken advantage of this. The gentleman got a job with Jaguar Land Rover in Coventry, and he applied to another job 2 years after. And he came back to us, even though he had completed his program with us for over 2 years. And we still prepped him. I wrote his reference for him, and he landed a more senior role in London with a company called QuantSpark. Okay, so for those of you, and remember, we have over 300 plus people on the call, but we can't take everybody. Okay, so we want those that are ready to start, those that are ready to get their journey started, those that are ready to transition. Would work with you, the first 20 people to start, the first 20 people to take advantage of the discounts, get started. So you get priority access. Most people don't get this access to some of the things I've shared with you until 3 months after they've started, but you don't wait until 3 months. You get started immediately. All right. The window closes Sunday midnight or when we get the first 20 people to take advantage. So I'll show you how to get started for those of you that want to start. My colleagues would also share the link in the chat, but I'll walk you through what you need to do step by step. Okay. So if you click on this link, it's going to take you into the enrollment center, and I'll walk with you step by step to show you how to register. Okay. So you click on that link, it takes you to the enrollment center. It takes you here. All you need to do is scroll all the way to the bottom. And we're going to do Q&A after this. So you have the opportunity to ask questions. Scroll all the way to the bottom and you'd see the health tech program. Okay. Click on that. And you have the opportunity. You can see the type of jobs you would get. If you click on job opportunity, for example, you see the type of jobs, the healthcare business analyst, healthcare data analyst, and so on and so forth. You click on enroll now. And this takes you to where you create a profile. Okay, so you enter your first name, your last name. Okay, and I'm going to show you, I'll show you how to. So you enter an email. Your email is what takes you to how you create the profile. So let's create the profile together. I'm just going to enter an email. Just give me 1 second. I want to use an email that I've not used before. So you get to see exactly what you'd see on my screen when you start the registration process. Okay, so I'm going to copy this email. You enter your phone number because you'll be required to verify your phone number. Read the terms and conditions right here. Select I've read the terms and conditions, and then you click on create account. The moment you click on create account, it will create an account for you. Now, the beauty about the discount is you can start in March. You click on March, you are starting immediately. If you are one of the first 20, you take advantage of the discount. I can see a whole lot of traffic coming into the website for those who are trying to make payments. So you can start in March, you can start in April. Maybe you need some time. You don't want to jump and start in March. You want to start in April. You take advantage of the discount, but at the same time, you get to start in April. Okay. So you want to start immediately, for example, you click on March and you scroll down to where you have the payments. Now here, for those of you making payments in 5 installments, which is the most flexible choice for you, it means that if I change this to USD, it means that I'll be paying $200 per month for 5 months. And by the time I'm done, I would have paid $1,000. So instead of $1,250, I get to pay just $1,000. So I save $250. Now, if I choose the smart choice, which a lot of people go for, I make payments in 2 installments, which means I get additional 8% discounts on top of the 20% that already exists. So instead of paying 1,000 in 5 installments, I get to pay 900 in 2 installments. So I make $450 payment today and I make the next one the following month, and I save a total of $350. And of course, the most popular option for those making a one-time payment, you save a whopping $400. So you get additional 12% discount on top of the 20% that already exists. And all you have to do is click on that. You pay $850 instead of $1,250. And you can make payments in any currency. If I want to pay in pounds, all I need to do is come in here and click on pounds. So if I'm making payments in pounds, I save 315 pounds. If I'm making a one-time payment, I save 275 if I'm making 2 monthly payments, and I save 195 if I'm making 5 monthly payments. So you choose your preferred option. Okay, so let's say we go for the 2 monthly installments because I want to save a lot of money, right? So I click on that and I click on apply discounts. And this takes me to where I'll be required to confirm my phone. And I would also, what you can also do is you can edit the next payment date. So let's take, for example, your next payment doesn't come on the 21st. Your salary comes on the 26th. All you have to do is click on edit, and you can select 26th or you select 27th. Okay, depending on when your salary comes. So let's say salary comes on the 27th, your second payment comes March 27th. You click on save. So what would happen is you make your first payment today, the 21st, second payment comes in the 27th of March. You come in here, you click on I've confirmed information. You also click on the terms and condition and you click on pay now. Okay, but you need to also confirm your phone number. So I'm going to verify my phone, and you would also be required to do that as well. So I'll click on verify and an OTP would be sent to me. Okay, so I'm just going to get that and I'll go ahead and show you exactly what you need to do after verifying. So you verify your phone number, you verify your email, and you get access to your profile. Okay, so I'm just going to wait for my code to come. Just give me 1 second. Okay, all right. So somebody's getting my phone for me. I left my phone upstairs. Okay. So as soon as my phone come, I'm going to confirm the code. And once you verify and you enter that, you have access to your profile. And once you have access to your profile, you complete the additional details, which I'll be showing you in the next couple of minutes. And we're almost on 20 signups so far because I can see a lot of traffic. Somebody's asking Oluwafunmilayo, will the link for payment be sent for May cohort since I'm not ready now? So Oluwafunmilayo, what I'll suggest you do is just go ahead and make your payments now. Thank you. And you'd have the opportunity to do that. Okay. So I just got my phone. I'm going to enter my OTP 386 388. Okay, so I'm going to verify my phone. So once your phone number is verified, you click on pay now and it takes you to where you enter your card details. Because I'm making payments in 2 installments, you'd see the discount, the money you would have paid and the discount you'd be getting, the 20% off. So I'll enter my card details. All right, so I'll just enter all of this. We should be doing the same as well. Your full name, your postcode, and then you click on pay. Now, the moment you click on pay and your payment is confirmed, you can pay with link as well. For those of you that have link, you can pay with link. You can pay with your credit or debit card. You see payment successful. You'll be redirected to also confirm your email. All right. So I'm going to confirm my email right here. So an OTP will be sent to your email as well. So if you don't find it in your inbox, go to your spam, you'd find the OTP. So 395350, verify my email. And once your email is verified, you'll be redirected to where you complete your profile. So your country of residence, let's say United Kingdom, I'd enter that, select your gender. What time do you prefer? For those in the UK, of course, 11 a.m. UK time would work with me. If you're in the US, Canada, you select 11 a.m. Mountain Time. Okay. How did you find out about Tenalytics? You enter the details there. I found you on Facebook, for example, or I found you on LinkedIn, or I found you on Google. I found you on YouTube, Adeza Suleiman, wherever you found us from, you select that option. Okay. You enter an alternative email if you have one, like a Gmail, for example, just in case you forget your password and all of that. What made you register? You type in what made you register, and then you select your time commitment. We always recommend between 1 hour per day at least for you to watch your videos, study and prepare and so on. So 1 hour per day for a week is roughly 6 hours per week or 7 hours per week. So you're selecting 4 to 6 hours or 7 to 10 hours per week and you complete setup. The moment you click on complete setup, you have access to your dashboard. Okay. So you upload an image. This will be used for, you connect your LinkedIn profile as well. So as you optimize your LinkedIn, so many things you do here would also get optimized on your LinkedIn. So you'd see your dashboard. You have access to start learning. All right. You'll be required to complete some onboarding videos and so on and so forth. You have your billing history right here. So you can see the first payment you've made, the second payment will be coming in on the 26th of March. You can pay early if you want to pay early, or for those of you that perhaps the payment date is very close by, you really don't have the money to pay at that time, you can request for a grace period and somebody would attend to that for you. And this is what gets you in. This is what gets you started. Okay. All it takes for you to start is just $200. We are paying in dollars, or about 130 pounds, 150 pounds thereabouts if you do the conversion. But the conversion is done for you automatically on the platform. This is how you get started. So for those of you who have registered so far, you have the early advantage, like I mentioned, the early access, the front of the line advantage. Tenalytics is accredited by the American Council of Training and Development in the US. Okay, so for those of you that have filled the attendance, you get my slide. You'd have the opportunity to click on these links. You have access to see the accreditation, Tenalytics, and the amazing work that we are doing across the space. All right. So I'm going to take questions before we call it a day. I'll take questions before we call it a day. And I would also give an update on the number that we have so far. All right. So somebody is asking, if I pay 153 pounds, how much? It depends on the plan that you choose, Oye. Okay. It depends on the plan that you choose. So if you're making payment in 5 installments, the payment you make is a little bit different from if you're making payments in 2 installments or you're making a one-time payment. Okay. So let me see if I can show you that again very quickly. So you'd see exactly the amount you'd pay. So while I'm doing that, I'm going to check into the chat and I'll take questions. And for those of you that have your hand up, I'll also take your question. Can I pay in 3 installments? No, you have 3 options: one-time payment, 2 monthly payments, and 5 monthly payments. I beg your pardon. All right. So you scroll all the way down, you click on health tech, you click on enroll now. Okay, click on enroll now, and you see the three options. Okay, so you can change the currency right here. If you're paying in Canadian dollars, you're in Canada, you can leave it in Canadian dollars. If you're paying in pounds, you want to pay in euros, you want to pay in naira, you have all those options right there. So if I choose pounds, for example, if I'm making my payments in 5 installments, I'll pay £153 for 5 months. Okay. At the end of the day, I'd make a total payment of £766 if I make my payment in 5 installments. If I make my payments in 2, I'd make a total of £690, and I'll pay £345 twice. So which means I get additional savings, additional 8% savings. And if I'm making my payment as a one-time payment, I pay £651. I save additional, I have additional savings. I get to save a total of £315. Okay. And that's the difference between the three options. This is the most popular, the one-time payment. And of course, the second payment is also as well popular because of the cash savings that you get. So let me take some questions in the chat, and then I'll come back to get you to unmute yourself. Okay, so many questions. I'm just going to maximize this so I can see everything at once. What type of learning tool do you suggest we use? Laptop, you need a laptop. You can't do this with an iPad. You can't do this with a mobile phone. You need a laptop. Okay. Is it only healthcare professionals you are training? I got domain knowledge in civil engineering. Do you also train data engineering? Absolutely, we do. Emmanuel. So this program, the program you've joined today, is for the health tech professionals, those that want to get into health tech, people that want to become healthcare data analysts, pathology data analysts, medical data analysts, clinical data analysts. This session is for them. Okay. Now, for you, Emmanuel, who wants to learn data engineering, all you have to do is click on that same link. Okay. Click on the same link and simply go to. So once you click on the link, it brings you here, and simply look for data engineering. You'd find data engineering right here. So click on data engineering. You'd see what the curriculum looks like, and then you can go ahead. The beauty is you also have the same advantage, the same discounts available today for those that pay today, the first 20 people. Emmanuel, you also have the advantage. All right. I hope that answers your question. So let's go to the next question. Is there a laptop requirement? Not really. You need an entry-level laptop, nothing high-end. So you have minimum of 256 gigabyte SSD, 8 to 16 gigabyte RAM. If you have 8 gigabytes, it's fine. If you have 16, it's also fine. 8 is actually very okay for you. And what else? In terms of space, 256 SSD, ROM, you need 8 gigabytes RAM, and that's pretty much it. Core i5 is also fine. You don't need anything, overboard for your laptop. An entry-level laptop would be fine. It's not allowing me to add my OTP. I'll just refresh, try again, Juliet. I'm sure that would. And for anybody who has any confusion, okay, so I'm just going to share this very quickly. If maybe you've tried to register, you've tried to make payments, but you're having issues for any reason, all you need to do is you can reach out to any of us on this number. Okay. You can call any of my colleagues on these numbers. You can send us WhatsApp messages on any of these numbers, or you can simply send an email to admission@10analytics.io or enquiries@10analytics.io, and somebody would respond to you. So you can just take a snapshot of this page. Okay, just take a snapshot. I tried to register. This is what I saw. I couldn't register, so I would have been one of the first 20. Okay, so send that to us, send a WhatsApp message, and somebody would help you address any issues that you have. Okay, let me see. Let me take more questions very quickly. Okay, Shasha is saying, I don't have domain knowledge in healthcare, but I have a background in tech. Can I join this program? Absolutely, Shasha. I shared the story. There are more stories. I can't just share everything because of time. Let me share the story of this amazing lady, Ramat. Because of time, I didn't share Ramat's story. So, Shasha, Ramat was a customer service rep in the UK. She worked with British Gas as a customer service rep, but she wanted to land a job in healthcare. But she didn't want to land a job as a nurse or as a care worker. She wanted to land a job in tech, working with the NHS. So what did she do? She joined our program, and today Ramat is a business architect with the NHS, also on full visa sponsorship. She had no healthcare background, no healthcare knowledge. Let me share somebody else with you again. I think I shared his story the other time. His name is Mawutin. Mawutin currently works with the NHS as a pathology data analyst. The pathology department of the NHS as a data analyst. Mawutin worked as an operations manager. Okay, I'm going to take you to his profile. He worked as an operations manager back in Nigeria before he moved to the UK. So he had no experience. Okay, he had no experience. And Mawutin was also able to transition. Same with Pavel, who was a teacher. So that's Mawutin. Again, he positioned himself just like I explained to you the other time. Positioned himself as a data analytics consultant with Tenalytics. And today he works as a data analyst with the South Tees Hospital NHS Foundation Trust. Okay. And this is Mawutin right here. I prepared Mawutin for the interview. I worked with Mawutin for his referencing and so on and so forth. You also have somebody like Pavel. I shared Pavel's story with you. Where's Pavel? That's Pavel right there. Pavel was a teacher back in Cameroon. He had no experience in healthcare, zero experience, had never come across anything healthcare. Today, Pavel is a healthcare data and reporting analyst with the Arizona community physicians in Tucson, Arizona. And how did he do it? The exact same way I explained to you. What did Pavel do? He learned the data analytics skills. Okay, he learned data analytics skills. He tailored his CV to a healthcare data analyst CV. His LinkedIn to a healthcare data analyst, LinkedIn profile. He did all the things I talked about from interview prep. I prepped Pavel for his interviews. I worked with Pavel when it came to negotiating the salary for this particular job, and Pavel was able to land the job. Okay. So if you want to land a job in a particular space, the best way to learn is to learn in a project-based environment, which is doing that job, learning by doing the job, and then showcasing your work as a professional within the space. Okay. Let me see. Amina is asking, Ama, sorry, not Amina. Ama is saying, I already work as a business analyst, but I want to get another job as a contractor. Can this work for me? Or is it just for permanent roles? There are so many contract jobs. We always advise people that have some level of experience to go for contract jobs. Okay. So for someone like you, Ama, contract jobs will be fantastic. All right. Let me see if I can show you something. Let's just go to read.co.uk very quickly. And let's search for a business analyst role. I'm not going to specify any city or postcode. Let's search for a job and let's see. So what you want to do, AMA, is this is just one platform I'm showing you. There's so many others you can use. I want to come here and select contracts. Okay, I want to select contracts. And let's see the type of jobs. Let me see if they have the salaries. Most of the salaries are not posted. Yeah, so this, for example, one thing I did it myself when I was working in the UK. I did a lot of contract jobs. Efemena, the co-founder, did a lot of contract jobs too. A lot of you don't know Efemena, the co-founder. This is Efemena. That's the co-founder of Tenalytics. Efemena did a lot of, work. When he worked with the post office, for example, it was on contract. You can see that right here. Now, let me tell you the beauty of contract jobs. £550 per day. Okay, so when you look at this, £550 per day. I've worked contract jobs where the pay was as high as £850 per day. All right. And there's so many opportunities within the space. So, yes, you can do a contract job. What I advise you to do, Ama, is when you register, send us an email. Okay. Right. When you register, send us an email. This will be useful for you, but would have to tailor you to the business analysis program rather than the health tech program. Okay. So when you're registering, let me show you what you do. When you're registering, just like the other gentleman I directed to go to data engineering, what you want to do is go to business analysis and select that. And we're going to work with you to help you make that transition to a contract role. Let me see. We are based both in the UK and also in Canada. Motorola in London in the UK and Alberta in Canada. Let me see. We have more questions that haven't been answered yet. Is it possible to get part-time job? Absolutely. Part-time remote job. Somebody was asking, can my son who is 19 do this? I love that question. And let me see if I have. There was an 18-year-old that landed a job. Unfortunately, he's not on this slide, but I'm going to show you his LinkedIn. Okay. I'm going to pull up a slide where you have the 18-year-old that landed a job. He joined our program. Just give me 1 second and I'll pull it up for you. And I always ask people the question, if an 18-year-old, and recently, last year, December, thereabouts, a 60-year-old landed a job as a business analyst after joining our business analysis program. His actual job title was health and safety data analyst with the Home Office. So he got that job with the Home Office and he's doing an amazing job at 60-year-old. Okay. So let me see if I can find the 18-year-old very quickly for you. Just give me 1 second. I'll try to bring that up. Okay. All right. If it's not here, if I can't find it easily because of time, I'll just take you to the LinkedIn profile. Okay. I have him here. All right. So this is Christian. Okay. Christian was 17 when he joined us. So his brother joined a session like this. And his brother had a job and was not looking to transition, but he wanted to learn something and see what we do at Tenalytics. So he joined a live free session like this and he registered his younger brother, Christian. His name is Christian. He registered Christian into our data analytics program in September 2024. By July 2025, that's about roughly, say, 7 months after Christian joined, he landed a job at the age of 18 and he made a post about it. All right. I'm going to click on that link and it's going to take us to the post. Let me use a different browser so that it takes you directly to LinkedIn. So I'm going to click on Christian's post and you'll see the post that Christian made. Okay, I'm going to read it out and I want you to digest what an 18-year-old was able to do. So this Christian made this post, Christian Adeshola, against the odds, landing a tech role at 18. In a world where tech seems complex and so on and so on, in September 2024, I was 17 at that time. My senior brother, who had always encouraged me to aim high, saw potential in me and paid for a data analytics training with Tenalytics. His belief gave me the push that I needed. Over the next 4 months, I immersed myself in the world of Excel, SQL, Power BI, Tableau, and so on. By December, I completed my training, and February 2025, I began hands-on internship. The internship I talked about with Amdari, if you remember. So he said a lot of things, and he talked about from late March onward, I sent out applications after applications, hoping for an opportunity, but rejection became a regular visitor, which always happens to the best of us. No matter how good you think you are, rejections would happen. But what is most important is how do you take the rejection and the feedback and use that to do better in your next interview? Okay. He said, at times it was discouraging, but I reminded myself that preparation meets opportunity eventually. And it did. I received a message from Market Trends International inviting me for an interview for the role of a data processor and analyst. Long story short, to my surprise and joy, I was offered the role, getting my first data job at just 18 years old wasn't just a win. It was proof that anyone can break into tech with the right support. And he posted a screenshot of the job offer. And yeah, that's me right there giving him a thumbs up. And just look at the engagement from this post. 1,114 people liked, 1,196 people, commented. Yeah, and that's Christian at the age of 18 landing a job. So to answer your question, can my son of 19-year-old do this? Absolutely. If Christian can do it, then your son can also do it. Okay. Let me see. Please, I don't know which particular health data analyst I want to join for now, and I don't want to lose the discount. Join the health tech. The most important thing I want you to know is to join. Okay. If tomorrow you say, oh, I think I want to do data engineering, I want to do this or that, you can always make a switch. But the most important thing is you have registered, you've taken advantage of the discounts, and so on and so forth. Okay. So that's what you want to do. That's what you want to do. How will AI affect these roles in the future? Fantastic question. AI today. In fact, when I showed you the curriculum, let me show you the curriculum again one more time. AI would ensure that you are able to do your job a lot faster, a lot more efficient, and a lot more effective. One of the things that we do at Tenalytics is we show you how to use AI to do your job. All right. And when I showed you the curriculum, one of the generative AI tools you're going to learn how to use is ChatGPT. That's one of the generative AI tools. But there are so many other data analytics related AI tools. For example, you have Zebra AI. Sorry about that. You have Zebra AI. You have Quadratic. Quadratic is one of the most amazing tools you can ever use as a data analyst. And I'll tell you what Quadratic does. Quadratic will take a data set that you have and it's like you having a conversation with Quadratic, with a person to say that this is what I want to get out of these data sets. Go to this level of detail in the data set. Show me these patterns and trends, or show me, you can chat with Quadratic and it gives you insights. This dashboard that I built, I had initially started with Quadratic. We don't have enough time, I'd have shown you. I initially started with Quadratic before I went back to Microsoft Excel. Okay. So what AI would do for anyone today who wants to transition into tech is simple. AI would exponentially increase how efficient you become and how effective you become. Okay, a lot of people say AI is going to take my job. AI is not taking anybody's job. Those who don't have the understanding and know how to use AI are the ones who are at risk of AI taking over their jobs. But if you are a health tech professional today, you are a data analyst today, and you know how to use AI to complement the skills that you have, people would wonder how you perform magic. A report that should take 24 hours, you churn out the report in 15 minutes. Why? Because you understand how to use different AI tools to help you get there. Okay, so I talked about Zebra AI, I talked about Quadratic. You have Claude by Anthropic, you have Claude, you have Julius. These are a couple of the AI tools. We're going to expose you to these generative AI tools, but the major one you'd focus on, which you'd learn in class, is what? How to use ChatGPT as a health tech professional. But there's so many other tools we're going to expose you to on how to get your work done. Okay? Just to answer the question from the person who asked that question. So let's take more questions. Let's see if we have more questions. Do I need medical coding knowledge? No, you don't, Chigozie. You don't need medical coding knowledge to get started. It's not, none of the people that have landed jobs had the knowledge of medical coding to transition, except you are applying to get a specific job within that space. Is ChatGPT allowed in companies? Yes and no. Okay. Yes, because you can tailor and create workspaces within ChatGPT and control the data security. Okay. What part of your data stays with ChatGPT? What part of the data is within your organization? Okay. So in that case, yes, you can, by creating a workspace, by tailoring ChatGPT to your organization. And there are so many organizations that use that today, from the consulting companies, Deloitte, um, PwC, McKinsey, and so on and so forth. They tailor ChatGPT and so many other generative AI tools, Gemini, to their own specific organization. Okay, so you control the data access from there. But generally, you cannot just take your organization data and go, upload it on a free ChatGPT profile that you've created. That's very wrong for you to do. Okay. So these are the things we also show you and talk about. How will you help with UK Global Talent Visa? Can you explain more? Absolutely. So what we do, because the UK Global Talent Visa is you have to be very meticulous when applying. And a lot of people don't know that you need to be meticulous from all the evidence, because it's evidence-based. You must show that you've contributed to the digital economy for you to get endorsed by TechNation or any other endorsing body, depending on the route you want to take. So we walk you through the steps and the process. Like I said, Prashanth, it's not open. This session is not open to everyone. It's open to those who have the front of the line advantage. So you join that session. We bring in experts and people who have gotten global talent, the global talent visa. A lot of people don't know that you can get global talent, the global talent endorsement, if you are an artist, you know how to draw, you have some artistic skills, because there's the arts and culture. Okay. Or you have some you've done cultural dramas back in your home country and so on and so forth. You can use that as part of the evidence that you submit for endorsement. A lot of people don't know. Okay, so we walk you through the process of what it entails. Number one, you hear from the experts who have gotten there. They've done this, they've gotten those endorsements, they've gotten the global talent visa. So you know exactly what to do and what to expect. Secondly, you need three references from reputable organizations and reputable professionals. We write a reference for you from Tenalytics or from Amdari. Okay, so we help you to that extent in providing that. And that's the extent to which we provide you with the support. All right. And for some of you who would need, professionals to work on this for you, we direct you to the right professionals that we know would help you get results when you put in the application for the Global Talent Visa. All right. Okay. Jocelyn is saying I mistakenly selected April instead of March. That's fine, Jocelyn. What you want to do, Jocelyn, is my colleagues are in the chat with you, okay? But what you also want to do is just send a message or send an email. Send an email to this email right here at the top right corner, admission@tenalytics.io. Just send an email. Say, hey, I selected April by mistake. I want to join in March. Somebody would help you make that adjustment. All right. We have so many other questions. I'm just going to take questions from the chat. Esther is saying my first degree is in human anatomy. Whoops. Okay. It's in human anatomy. I worked as a banker in Nigeria. I was a banker for 8 years and rose through the ranks to become a branch manager. I moved to the UK 2 years ago, customer service for the bank for 1 year. However, I'm currently a senior support worker, a role I have been in for 1.5 years, and I've done a couple of training in healthcare. I possess NVQ3 diploma in healthcare. You are the perfect candidate, Esther. Okay, you are the perfect candidate for all the things I've said so far. Perfect, perfect candidate. If you don't join, Esther, I'll be very surprised what else you want to do. Okay, so you don't need to go for business analyst. What you need to go for is the health tech program. Okay, so you've worked in the banking industry, you have a degree in human anatomy, you currently work as a health, as a support worker, you've also worked in customer service and so on. You have all the ingredients for somebody who will thrive within health tech. Okay, so what you want to do is to join the health tech program. A lot of people, most of the time, you think you overanalyze, and by doing that, you confuse yourself at the end of the day. Okay, so everything you need to take your human anatomy background, to take your experience within the healthcare as a support worker, and so on, to transitioning into the health tech space, everything that you need, you're going to get it within the health tech program. From your mentorship sessions are not going to be generic like everybody else. Your mentorship sessions will be tailored towards health tech by the time you start. Okay, so you join the generic mentorship sessions, but you have dedicated sessions where somebody will join you, somebody from the UK, for example, Esther, who is in the healthcare space, who transitioned from a support worker into health tech. They come to the session, you have the opportunity to ask questions, they interact with you, and you have a body mentor that you can always reach out to for guidance whenever you need one, and so on and so forth. Okay. Are the live classes only on Saturdays? Yes. Your live classes are on Saturdays. That's where you have the opportunity to join a professional like myself, teaching you and working on projects. So you're not learning the conventional way by going through a presentation. No, it's a project-based learning environment. Okay. So if we're learning Excel, we are solving a problem for Deep Care Hospital. We're solving a problem for the NHS. We're solving a problem for Alberta Institutes, Medical Institutes in Canada, and so on and so forth. Okay, so that's how you learn on Saturdays in a live class. Every other day, you're on the LMS, you're solving problems, you have assignments, you have presentations, and so on and so forth. Okay. Is MacBook ideal? Yes, MacBook is ideal for the program, but there are some things you would have to do to install on your Mac for Power BI. So you don't have a dedicated application for Power BI on Mac. So you'd have to install a virtual machine. All the guidance, you have the guidance right there in the LMS. We show you how to do that. But every other thing, you have that properly, sorted out for you. From your Excel to SQL, there's a PostgreSQL, there is Tableau for Mac, and so on. So you don't have all those issues apart from Power BI. So we show you how to install a virtual machine so you can install Power BI on your Mac. Okay. We've taken a lot of questions. Now, do you help people in Germany land job? Interestingly, you asked. There's a lady who landed a job. She doesn't live in Germany anyway. She lives in the UK, but she landed a job with a company in Germany. I'll see if I can find her. Let me see if I can find her on LinkedIn. Oh, let me see. Yeah. So her name is Ene Ojaide. Okay, Ene. Ene joined Tenalytics data science program. Then she moved to Amdari for her internship. And that was where Ene landed a